I'm going to turn it over now to Dr. Scott Wilson. He is the Chief of Emergency Medicine here in the city. And I'll turn it over to you now, Dr. Wilson, for your comments.
Thank you, Brent. Yes, I'm the Regional Emergency Medicine Chief for Eastern Health. I deal with the adult emergency facilities here in the city and the regional facilities within Eastern Health. Now, the city is the only tertiary center in the province of Newfoundland and Labrador. And what we mean by tertiary, it's the type of medicine that can't be done anywhere else in the periphery, your neurosurgery, your cardiac surgery, your psychiatric services, your plastic surgeries. The list is long. So there's only one center in the province of Newfoundland and Labrador, and that's focused in the city of St. John's. And we are also responsible for the majority of teaching in the Royal College and the College of Family Physician residency programs. Our program does have a residency program in emergency medicine through the College of Family Physicians, and that program has quadrupled in size since its inception 7 years ago. I was recruited back to the province in 2003 to lead the emergency physician group, and since that time we have been building in a very positive direction to maintain the physician group that services the only tertiary center in the province. We're the only physician group that is composed of certified emergency medicine specialists, and we are also just been granted discipline status within the faculty medicine, and that is a first in the history of the province. And that's important because when we're trying to recruit physicians to come into those positions to lead the academic component of emergency medicine and to help with such things as Dr. Taylor mentioned about doing outreach programs to bring teaching programs to the periphery to increase the status of the physicians in those areas. Right now, we are a relatively stable workforce, but we are in, as you all know, in a negotiation year, and we have put forward on the table a submission that we feel will allow us to maintain our competitive edge compared to other tertiary academic centers across the country and Atlantic Canada. We are the only have province in Atlantic Canada, and it is on those facts that we have based our submission. We feel that if negotiations are not successful, then there's a serious risk of retention in the emergency group that has taken 7 years to build up. On a daily basis, we are being asked to consider relocating our practices to other parts of Atlantic Canada and the nation. And those requests have been put off till now because we are a group of physicians that want to work in this city, want to work for the citizens of this city and the province. We are in a negotiation year, and we feel that we've submitted a fair and balanced submission to maintain not only our competitive edge, but will give us the opportunity to seriously go after those recruits and bring them into the province, and so that we can get over the hill where we need to be when it comes to staffing situations. If negotiations fail, we feel that the group will dissolve, and to try and rebuild that would take an eternity. So this is really the make or break time of this fiscal year. We are also concerned with the day-to-day activity in our tertiary centers right now. Our waits are too long for patients to be seen. We are 3 times the national average for patients showing up into an apartment, getting frustrated with the length of time that they're waited, and turn around and leave without seeing a healthcare person. 3 times the national average. And there are people that we know who have left our emergency department and have come back at a later time or date who are much sicker. And we also have isolated incidents where people have left the department and have come back and died. This is not acceptable. And our proposal is to increase the number of physicians that see patients on a daily basis. It keeps us, again, not only competitive with the other centers across the country, but it's the issue now is that we are so inundated with volumes of ill people that the workplace demands are getting to be so to the point that physicians are already considering relocating their practices elsewhere. So these are important issues that need to be addressed now. We also have issues about overcrowding in our emergency departments. It's a national problem. We are not immune to it. We are trying within the buildings themselves to try to address other issues other than physician services that contribute to patient wait times, but those are medium and long-term solutions. The immediate solution to try and take a chunk out of that apple now is to increase physician services. We are not asking for more money to do the same thing. We're asking for a competitive package so that we can increase the physician service in the tertiary centers. So it's important in that regard that we do not allow the failure to have years of progressive work to go by the wayside and actually dissolve away. As I said before, we've just been granted discipline status in the faculty of medicine. We are the last tertiary center in the country to have that categorization. We are not fulfilling adequately the academic component that we are expected of. The dean is very concerned about this, and we need to fill that void. But we cannot recruit trained, highly skilled physicians into those positions if there's also not a competitive wage package for them to do their clinical work. They just can't come here to be academics. They also have to work and put bread on their own tables. So again, it's not that we are looking, as everyone is saying, shooting for the moon or elsewise. We are looking to be competitive. We are looking, and we know what the packages are in Atlantic Canada and across the country, and we're trying to position ourselves so that the only tertiary center in this province can compete. And so that is where we're progressing now, and we're hopeful that negotiations won't fail us. Thank you.
Thank you, Dr. Wilson.